What about men? Well, if it's reproductive health that we're talking about, they are involved. Uh, we're going to dispense a little bit of the niceties that I started with before because I know that you are eager to get home. But one of the things that when we do assessments and evaluation, and I've gone into communities when they're going to try to move the needle either to get an initiative to get the Latino community engaged or male involvement or whatever it is, they always tell me, well, how do you start? And my comment is always, you start with the people that were in the room at the end of the day. And I think, yes. And so that tells me a lot. The people that are in the room at the end of the day are the people that I want to go and engage in this process and whatnot. I'm going to start with a story. Not long ago, you know, when we started doing this work in California, there were 3 dimensions of male involvement that we wanted to do. We wanted to engage the community to do health prevention with medically accurate information, linked young boys and young men to clinical services that they needed. And the third prong was to really affect the community norm and the attitudes of young men regarding teen pregnancy prevention. At that time, for 20 years, teen pregnancy prevention had been squarely put on the shoulders of young women. So you prevent teen pregnancy by educating young women about how they can go about, you know, avoiding an unintended pregnancy. And I think that over time, what we did was we created a pretty big burden on a teen young girl. That is to say that, you know, not only do you need to process information, but you also have to have the wherewithal to express your desire, and you had to then also be very firm in your commitment about what you were going to do. None of that really talked about partner communication. Young men simultaneously were being taught, you know, being sexually experienced was the measure of being a man. So you have in a community capacity building on one end and the general norms and behaviors on the other hand, kind of clashing. So when I like to do this discussion, I like to talk about what I dream of as being the goal of this work. The goal of this work is that if we do our work correctly and with competence and with, you know, gusto, that we will have a situation where 2 young people that are attracted to one another have the ability to actually share what it is that attracts them to one another and understand the difference between physical attraction and the communication that goes with that. That he can actually express his desires and his limitations, that she may be able to express her desires and her limitations, and that communication is done respectfully and can be accepted so that you can decide how it is that you want to go. And that is very, you know, we haven't got there yet, and I think we're far from that. But I think it's very, very possible. I'm going to skip the conocimiento parts. There's 2 dimensions because in many communities we have to do interventions because we already have young fathers. You know, and a young father, when I first started working in a community, there was a young man named Hector. And Hector had 2 girlfriends that were pregnant simultaneously. I was starting my career, not a good way to start your career with your namesake having this kind of jacket in the community. And so then all of a sudden, you know, as these 2 young women who were avoiding one another but shared the father of their child in common, as they were approaching delivery, there was an intake of a 3rd young woman who was early in her pregnancy, the same young father. These are not normal. This is not, you know, I don't share this to say, oh, you know, there's young guys out there having multiple births. But this young man had 3 young girls pregnant simultaneously. And I remember going back into the office because the young women were priority take-ins during the case management case management services, because the primary goal was healthy birth outcomes. But he never made it on the radar screen as being significant enough to be in case management. So we're sitting there looking at the list of the waiting list, deciding who's going to be in took in that week. And all of a sudden I said, so what does it take for a young man to finally be taken in when he is going to probably do this again? And I remember that the director at the time said, you know what, screw the triaging list. We need to get, screw the triage list. We need to get Hector in. And you know, and I did, and we did, and you know, and there was a lot of work that needed to be done. But I mean, these are these realities that I'm sure exist here in Iowa. You know, maybe not to that same extent, but you know, potentially. It means engaging fathers is that we are going to help them get to where they need to be in terms of knowledge, information, and a desire to do better. Why it's important is because if we take a community-based approach, it's very critical that we engage everybody as part of the solution. And then, you know, why is this important to me is because, you know, I think it's important that if we're going to hold young men accountable, then we have to give them the skills and capacity and information to be held accountable. When we first started, there was scarcity of educational information for young men. I mean, there's a lot of information out there, but none of it was very designed for the mindset of young men. There was limited state and federal funding at the beginning. Now there's more, but it's still targeted and not comprehensive in everywhere. And there were limited evaluations of programs implemented in the 70s, and therefore their lessons were lost. I actually found a manual that was published based on a 1970s project. And they said, you know, Hector, what do you think? And when I read the evaluation findings, the goals of the programs were solely about the men being supportive of their sexual partners. It didn't identify them as being, you know, having a sexual sense and whatnot. So it was very limited. And then at that time in California, clinical services for young men that were offered could only be offered if they were associated with a young woman who had a sexually transmitted infection. So, you know, this is not long ago. I had a public health official in San Diego, and Guillermo grew up in the male involvement programs, earned his MPH, and now was working in the system over there. And he calls me one day, and he says, Hector, I just heard something that I think is just, I've never heard before. And I said, what is it, Guillermo? He says, like, I heard that guys couldn't get clinical services in California unless there was an STI associated with a girl. And then I realized that we hadn't done a very good job of teaching him the history. I said, Guillermo, that's actually true. He said, how could that be true? He is post. His adolescence and his profession is post those requirements. And so he couldn't fathom that anybody in their right mind would ever design services, but that's the way it was, because the pie has never grown. And let's face it, that when the pie doesn't grow, the stakeholders really work to keep the services where they want them and they believe the services are very needed. I don't fault them for that. That's called effective advocacy. The issue is, let's make the pie bigger. And that's oftentimes where we need to work constantly. The other part of it is we need to address the social norms that exclude young men from teen pregnancy prevention, because we don't do a good job. My example earlier is that when do we do this? At what age do we do this? You know, with my son, when he was about 3.5 years old, he told me and Lucy that he was going to have, this is exactly what Diego said, 100 children, 50 boys and 50 girls, and the oldest one's name is Jim. That's what Diego would say. And as things progress, you know, and he's like, where did he get this idea? I said, that's how big his heart is. But that was because we were engendering this spirit that he needed to have a concept of what his family was going to look like. That's what a 3.5, nearly 4-year-old boy's concept of family looked like. Fast forward to kindergarten. He then said, Dad, I think I'm going to have 50 children, 25 boys and 25 girls. The oldest one's name remains Jim. He then was going to build a house across the street from our home in the park. And he was going to have 3 jobs. He was going to be a race car driver, a firefighter, and an architect in order to be able to support his family. That was the